Okay, the next shock that we're going to talk about is the next one that you see quite often in the field, and that is septic shock. So septic shock is when we have internal infections. It's a systematic shock, so it's full body shock. But our body is trying to fight off some sort of full body infection. It goes a lot of different directions, and we'll talk more about all those different directions in your medical chapters. But right now, just that overview of septic shock, some things that we see. Obviously, a fever. We have some sort of infection. We always have that fever that goes along with it. So if you have a fever with signs and symptoms of shock, your brain should, be thinking, oh, this might be septic shock. Some other things that we may see, and it's kind of common if you're running on a geriatric population, is you may walk in and you just smell a smell. It's like rotting flesh smell. As we get older, our skin thins out and we tend to get bed sores. We can get ulcers. They become decubitus ulcers as they progress through. And really what's happening is our body's just rotting away with a wound, and obviously it's going to cause infections. It's going to be that systematic infection. So if your patient has a wound vac, or maybe you just smell something that smells pretty disgusting, be checking for those wounds. Like, move those clothes and be checking for any wounds. Is it like a bed sore, or is it an older person that's somewhat of a shut-in that doesn't get up and down a lot, doesn't move a lot? So, they've worn that skin away and they've started those ulcers. So that's something else to kind of look for, along with those signs and symptoms of shock and that fever, is just paying attention to if they have any kind of open wounds. Diabetics will get those wounds on their feet. That could be something else if they have that history of diabetes and maybe some foot wounds. So with your septic shock, one thing that is important is that you alert the hospital that you are bringing in a septic shock patient or a possible septic shock patient, because they have a septic alert that goes out, and these are things that they treat really fast, really aggressively. So, if you do have the fever, the signs and symptoms of shock, we have ulcers or some sort of possible body infection, and we have that low blood pressure, high heart rate, just go ahead and let the hospital know, hey, I'm bringing in a potential septic shock. So that's your septic shock. It's real simple, real basic. We'll dive into it more as we go through medical, but that's just your overview on it.